Hi, I'm Sarah. Today we're at Kennebec River Biosciences and we're going to be doing some finfish necropsy. We're going to take our fish, lay them out however you need to lay them out so you can keep your sampling orderly. And the first thing that I'm going to do is observe my fish externally, note any lesions. And then I'm going to take a 70% isopropanol and just quickly spray the outside of the fish, and then wipe them to remove any of the fish slime that's present, so that when I cut into their bodies, we're starting with a relatively clean sample. So I take the pectoral fin and I kind of hold it up a little bit, and I cut through the center of the stomach towards the anus of the fish. And then I just barely cut through the skin into that main cavity. And I'm going to carefully slice up towards the heart and very carefully take the swim bladder and pull it away from the kidney. Then I'm going to wipe my blade again. I'm going to alcohol it, remove the excess alcohol, and then I'm just going to flame it really quickly. So the first sample that I'm going to take is of the kidney. I'm going to do one quick slice after the blade is cooled, one quick slice into the kidney, and then I'm going to take a loop. And I'm going to really quickly put that in that slice, and then I'm going to rub that loop over the auger in the appropriately labeled quadrant. These are in sectors of 5, but you might be asked to do it in 10, depending on availability of media. I'm going to take a clean paper towel, and I'm going to set it on the side. I'm going to take a sample of the spleen, a sample of the kidney. Then I'm going to move to the liver. I'm going to take a piece of the liver. I'm going to put that next to the other kidney and spleen. And then I'm going to take a piece of the heart, and I'm going to lay that out as well. The spleen, the kidney, the liver, and the heart. I keep on wiping my blades clean just to keep things tidy on a clean piece of paper towel, but then I'm gonna slice into these again. And so the first slice I'm gonna take of the kidney, I'm gonna put it in my PCR tube over here. And then I'm gonna take and resection off a second piece of that kidney, the spleen, the heart, the liver, a small slice of each one to go into the virology tube. Going back for a little tiny piece of the heart as well. And the next two organs that I'm going to take a small piece of are the pyloric ceca. Again, just a small piece of that. I'm going to try to remove as much of the internal part of the pyloric ceca, which is predigestive. And then also a small piece of gill. I'm going to try to wipe a lot of the mucus away from the gill before I take the sample and put it into the virology tube. So that what we wind up with in the virology tube is a little tiny piece of each tissue without excess mucus or slime. This is the virology tube. It has samples of the kidney, the spleen, the liver, and the heart, and also a small piece of pyloric ceca and gill. This tube is for PCR, and it only has, this time, only kidney. For some testing, we might require different forms, like we might need parasitology, we might need a piece of head cartilage, or we might need to look at their gills or their skins for different parasites. So if that type of testing is being done, what I'd want to do is take a scrape of the skin of the fish using the corner of a slide and just scrape down the skin so you get a nice sample of what might be going on externally here. This type of sampling you would do if you had the ability to quickly read under a microscope what this might be showing you if there were any parasites externally. You can also take a piece of the gill the same way. I wouldn't wipe away a lot of mucus though for that, for a gill parasite testing. And then the other piece is the intestines that you can use. This is a really big fish for this kind of sample, but you just want to take a piece of the intestine and sort of splay it open, flap it open, and then I would take a cover slip, put that on top with a little bit of PBS, and then that could be viewed under a microscope to see if there are any external or internal parasites. If we were to take a head sample or need a head sample, you'd want to take the fish, and this is the way that I do it safely, but I take the fish, I roll it up onto its tummy, and I'm right-handed, so I have the fish basically in my left, and I'm going to take and just cut with a sharp serrated knife straight down into fish. I have its gill plates, its jaw, and its brain right in here. So we have everything, or its head cartilage right in there. That's what we would need for that type of a sample. If the fish is old enough and big enough, then we might be able to take a wedge sample. And in order to do a wedge, you just need to hold the fish. Again, this is the way that I do it without hurting myself. I cut straight down into the fish until I reach center of the fish head, and then I'm going to take that knife and I'm going to carefully go back towards that central cut. And what I'm left with is a wedge shaped cut, and it goes through the brain, all of that cartilage, and that's all we would need for a sample, is a wedge head sample.